25-year-old post-op ACL has way more options as far as exercises I can perform with them, as opposed to a 80-year-old total knee replacement patient. There's much less positions that are available to us to utilize, right? So like but a good example for how I try to use things globally is like, okay, quad sets are a really popular exercise right after knee surgeries. And so for people who don't know, a quad set is just, you're going to lay there, you might put something underneath the back of the knee for a little reference. You push the back of the knee down into the table in order to pretty much get more quad action, right? And you can even get some hip extension from it as well. One of my main exercises that I'll try and do with people is I'll actually just put their foot on the wall while they're doing a quad set, and I'll cue different positions of the foot in order to control where their tibia is going while they're doing the quad set. Plenty of times people feel way better doing it. We get more motion out of it. There's less pinching and nagging pain as they do it. They have a little bit more of a stretch on the back of the knee, which is what we're going for, right? We're trying to get knee extension back. Then another thing that is really that I think plays a big role as far as limited knee extension is the withdrawal reflex. So withdrawal reflex is like if you touch something hot, you'll really pull your hand back really quick. Or if you step on a nail, you'll pull your foot up, right? So it's like a global flexion movement, right? So someone who's like post-op ACL, that's kind of how they present. So what I'll do is I'll even set them up in like a similar position of like their quad set, and I'll actually try and utilize the cross extensor reflex to initiate more of the extension. So really all they're doing is they're pushing their foot through the wall of the side that's being operated on, and then they'll just take their knee and they'll bring it up towards their chest, because the cross extensor reflex is as one side flexes, the other side needs to extend. And so they'll just do sets of that. They'll do sets of their quad set, and that'll be effective exercise for them. Plus, it's a pretty accessible position because all they're doing is just laying on their back. So really, anyone of any age can do that as long as they don't have other issues with other joints involved, which happens sometimes, but got to work around it a little bit. So.